Hi, I'm Dr. Jack West, and I'm a medical oncologist with a focus in lung cancer at the City of Hope Comprehensive Cancer Center in the Los Angeles area. I'm also the founder and serve as president of Global Resource for Advancing Cancer Education. And this is another one of our series on COVID and cancer. I'm very happy to be joined today by Dr. Benjamin Levy and Dr. Jared Weiss. So let me turn it over. I'll have Dr. Levy introduce himself.
I'm Dr. Benjamin Levy, and I'm Associate Professor at Johns Hopkins School of Medicine and the Clinical Director for the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial in Washington, D.C.
And Dr. Jared Weiss.
I'm Jared Weiss. I'm a medical oncologist specialized in thoracic, Associate Professor of Medicine at UNC, Section Chief of Thoracic Oncology there, and Vice President of GRACE.
I'd like to just close with one question, and it may be a very simple question to you about kind of where we are now medically. Is there any limitation that your institution has or that you're recommending in terms of lung cancer care, screening, anything at this point? Or would you say that we are functionally now unfettered or should be unfettered and be thinking about the same level of interventions, perhaps other than a question of could this maybe be done just as well or better via telemedicine, but are there limitations in access to, biopsies, screening, et cetera, today compared to December of 2019, perhaps? Ben, you first.
I think for us, we really are trying to bring it back full scale what it was before. That even includes not COVID testing vaccinated patients before their EBUS or their CT guided biopsy, which was also a hamper even 2 or 3 months ago, where we had to do the COVID test first before any interventional procedure. And we're reshaping our policy on that as well. I think, again, clinical trials took a big hit during the pandemic in terms of just having resources available and having patients be able to come, having family members accompany them. So that's been our big push here, is to bring these trials or reanimate these trials to make sure that patients have access to them. I think screening efforts are ongoing. I think translational efforts, given our driver patient population, we were bringing in patients every 2 to 3 weeks to do correlative analysis, and that went down. We now have the ability to reanimate that as well. So the thing that I've seen most impactful with the people getting vaccinated has been the reanimation of clinical trial infrastructure. And I will say that the move to allow a care provider to accompany the patient has been huge. I mean, this is a family affair, as we know. Well, I mean, this is not just, I didn't go into this so I could just talk to the patient. It's the family dynamic. It's having people in the room to discuss care, and that dynamic back, I think, is special. And I think it's important as we move forward.
I just find myself thinking of all the interactions of asking about eating or activity, and husband answers and the wife looks like,
yeah. Well, it's amazing how much more rounded out you get of an experience for what that patient is going through by having the family member in there. Exactly. Some of the looks like, what are you talking about?
Yeah, like, oh yeah, you're always so active. Yeah,
exactly. I think it's really important.
Okay.
It's helped with the care, and so I'm all for kind of getting back to where we were, with some exceptions, and also bringing the clinical trials back for our patients.
Yeah, you can't hear an eye roll. That's the important thing.
That's true.
Although I think my kids are getting to that point. Okay, Jared, other thoughts? No? Okay. That's great. Well, I think a clear answer. And again, I look forward to the point where you really underscore the value. I think that is not a controversial point of bringing patients back for support. I look forward to that for inpatients and our outpatient clinic, hopefully very soon. So let me just close by thanking you all, Ben and Jared, for great insights here. I think we'll still look to revisit things in 5-6 months, hopefully an ever resolving issue, and but it's been progress. This has been a pretty upbeat discussion compared to some that we've had, and I really appreciate your insight, and thanks, Grace, and our audience for your attention. Until next time.
Next time.
Thanks, Jack and Jared.